Good afternoon.
Now, Palesa, according to the Free State MEC for Health, why has the department run out of funds to attend to healthcare community needs and to pay for its contractor bills? I mean, departments are given budgets every year.
Well, okay, let me start off by saying that today the MEC for Health held a media briefing where managers and CEO took a pledge to commit themselves to serving the people of the province. But in that same media briefing, he also admitted that there are very serious problems in the department. He said that they have a budget of about 8.1 billion rand, but on top of that, they still need another 4 billion rand. He also admitted that there's serious shortage of medicines, there's also broken equipment, and also an ever-increasing number of patients that are coming in and further, putting pressure on the health department. He said that the main problem is finance, and he also mentioned that, a lot of the problems he inherited, he said, signs of problems that were forthcoming already started showing in 2008. And over the years, they've been accumulating debt. With each new financial year coming in, they have to pay old debts first, and then only are they able to settle new debts. He said that they are in the process of, trying to remedy the situation, but it's going to take time. But he said that at the moment, there's not really much, that they can do except just to try and manage the situation as they go along. He also mentioned that there's a lot of patients coming in from provinces like the Northern Cape and Eastern Cape, as well as our neighboring country, Lesotho, that also expect services from the Free State Health Department, and that further exacerbates the financial constraints that the department is facing.
Now, Palesa, in the current cash flow situation, how will the department meet its service mandate obligation? What plans are there in place to ensure smooth running of healthcare within the Free State health centres?
Well, what's happening at the moment, the MEC has confirmed that the Free State Health Department is under provincial administration. He says that means that Treasury has been roped in to try and assist the department with financial management. But as for now, the situation is bad. That's an admission. They know. He says they know exactly what's going on. He says a study was done, which took about 6 months, and it was done by clinical specialists to determine exactly what are the needs at each of the health facilities. And that's how they came up to the shortfall of about 4 billion rand, which the department needs to be able to bail itself out for now.
All right. And just before I let you go, Palesa, how are the patients being assisted currently in terms of the shortages of services? Is there any alternative plans that the department has put in place?
Well, we've done several stories. The story, the problems in the health department is something that we've been following, over several weeks. And one particular hospital in Pelenomi, which is in Bloemfontein, that we visited, there's a lot of patients that are coming in, especially in the orthopedic section, where patients are admitted and they stay there for weeks on end. Some patients said that for about 3 to 4 months they've been there with, need for operations, which they haven't been getting. Now, when I raised this with the MEC, he said that actually in such instances where it's not an emergency, patients ought to be discharged, and when the space is available for them to be operated on, because right now, precedence is given for emergency cases, also women in labor. So when there's space for them to be able to be operated, then only will they be called from home to be operated. So it's more of a managing the situation as they go along. Also,
thank you, Palesa.
In Pelenomi, where there's a crisis, patients, sisters, and nurses actually have organized kettles where they boil water for patients, because previously, patients were using cold water to bath. So it's more of, your medical staff are actually trying to find solutions themselves to see how they can assist the patients and make them comfortable.
All right, Palesa, thank you so much for talking to us today. Palesa Matshane is an SABC reporter in the Free State, reporting to us about the latest shortage of funds encountered by the Free State Health Department.